Pharyngeal and laryngeal disease. The mouth must be examined thoroughly to discover any lesions, as discussed earlier. A sore throat may be due to primary laryngeal disease or as part of a systemic illness. So patients may present with an acute sore throat and malaise, and it's often extremely difficult to differentiate on clinical grounds alone, as between a patient with an acute parenchymal tonsillitis and a patient with glandular fever. In the latter disease, the lymphadenopathy is much more generalized, but the final diagnosis rests on the peripheral blood film and the positive Paul Banel test. The tonsils drain to the upper deep cervical nodes, which quickly enlarge in acute tonsillar infections. The node below the angle of the mandible and deep to the upper portion of the stenomastoid or sternocleidomastoid muscle is termed the tonsillar node. This often is the first to become tender and enlarged with a sore throat. The recurrent throat infections can cause chronic firm enlargement of the node up to 2 centimeters in diameter. And larger glands than this should be regarded with suspicion, and tuberculosis should be considered. But the presence of thrush produces a very typical appearance, and its significance depends on the age and the clinical status of the patient. It is common in at the two extremes of life, that is in babies and in debilitated old people. In middle age, it is commonly complicates antibiotic and immunosuppressive therapy, and it may also suggest the possibility of HIV infection. Sometimes the tonsillar crypts may be seen to contain debris, which in some instances may accumulate and produce a large mass as a tonsilolith. And finally, one must be alert to the possibility of a tonsillar neoplasm and irregularity in appearance or marked asymmetry in the size of the tonsils, and this needs further investigation to exclude either a carcinoma or a lymphoma.